Our bodies are constantly sending us signals about our health, and sometimes these signals come from unexpected places. While we often pay close attention to symptoms in major organs like the heart, lungs, or stomach, we might overlook the valuable information that can be gleaned from our lips. Yes, those seemingly insignificant features on our face can actually serve as a window into our well-being. From subtle discolorations to pronounced changes in texture, our lips can reveal important health warnings that we shouldn't ignore. In this video, we are going to discuss a few health warnings that our lips might be giving us. Anemia Alert. If your lips appear unusually pale, it might be a sign of an underlying health condition, such as anemia. Anemia occurs when your body lacks enough red blood cells to carry sufficient oxygen to your tissues. Pale lips may accompany other symptoms, like fatigue, weakness, and dizziness. If you notice persistent paleness, it's essential to consult with a healthcare professional to investigate the cause and receive appropriate treatment. Oxygen deprivation. A blue or bluish tint to the lips, known as cyanosis, is a clear indication of oxygen deprivation in the blood. This discoloration could result from respiratory problems, heart issues, or circulation disorders. In severe cases, it demands immediate medical attention. If you notice a bluish hue on your lips, don't hesitate to seek medical help to identify and address the underlying cause. Hydration check. Dry, cracked, or chapped lips are a common issue and can usually be attributed to environmental factors such as cold weather or excessive sun exposure. However, persistent dryness might signify dehydration or an inadequate intake of essential nutrients. Remember to stay hydrated and maintain a balanced diet to keep your lips and body healthy. Allergic reaction. Allergic reactions can manifest on the lips as well. If you experience sudden swelling, redness, or itching, it could be a response to an allergen, like certain foods, medications, or cosmetic products. In severe cases, allergies can lead to a condition known as angioedema, which may cause the lips to swell dramatically. Seek medical attention if you suspect an allergic reaction. Viral infection. Cold sores, also known as fever blisters, are small, painful, fluid-filled blisters that commonly appear on or around the lips. They are caused by the herpes simplex virus and can be triggered by stress, fatigue, or exposure to sunlight. While cold sores usually go away on their own within a week or two, antiviral medications can help alleviate symptoms and speed up the healing process. Possible STDs. Unexplained bumps or sores on the lips might be a sign of a sexually transmitted infection, such as herpes or syphilis. If you are sexually active and notice any unusual changes on your lips or genital area, it's crucial to get tested and seek appropriate medical advice. Liver issues. Yellowing of the skin or the whites of the eyes, known as jaundice, can also affect the lips. Jaundice is often a symptom of liver problems, such as hepatitis or liver cirrhosis. If you observe a yellowish tint on your lips or elsewhere, consult a healthcare professional promptly for a thorough evaluation. Vitamin deficiency or fungal infection. Angular cheilitis is a condition characterized by red, swollen cracks or sores at the corners of the mouth. It can be caused by a deficiency in essential vitamins such as B-complex vitamins or iron. It can also result from fungal or bacterial infections. Maintaining a balanced diet and keeping the area clean can help prevent and treat angular cheilitis. Nerve irritation. If you experience a tingling or burning sensation on your lips, it might be due to nerve irritation or damage. Nerves in the lips can be affected by various factors, including injury, infection, or certain medical conditions like multiple sclerosis. Consult a healthcare professional if the tingling persists or is accompanied by other symptoms. Allergic contact dermatitis. Recurring dryness, flaking, or peeling of the lips might indicate allergic contact dermatitis caused by an allergic reaction to certain lip products, such as lip balms, lipsticks, or dental products. Switching to hypoallergenic products can often alleviate the issue, but if it persists, Seek medical advice. Hypothyroidism. Hypothyroidism, an underactive thyroid gland, can lead to various symptoms, including dry and pale lips. Thyroid hormones play a crucial role in maintaining skin health, and a deficiency can cause lip dryness and other skin issues. If you suspect a thyroid problem, seek medical attention for proper testing and treatment. Cracked corners of the mouth, also known as angular cheilitis, can sometimes be caused by a fungal or bacterial infection. Poor oral hygiene or a weakened immune system can increase the risk of these infections.